I'm here with Tess Little. She's a doctor in biophysics, and I'm sure we're going to be seeing a lot of her on this channel. Welcome.
Thank you. This is a privilege. Thank you.
I'm really interested to see what the link is between biophysics and medicine, and I'd like to learn more about your journey.
Okay. Well, at the time of doing biophysics, that was a question I was having. Where our focus is really looking at not just biochemistry of the body, but seeing what physics factors are actually playing a role to our physiology and our well-being, and what actually makes something fold, what creates the system to actually work, what's driving that.
What do you mean when you say make something fold?
Okay, so when I'm saying something fold, I was actually referring specifically as about a protein.
Mm-hmm.
So we all have enzymes in our body, they're little machines. But they actually have a way of naturally just wrapping themselves up in their three-dimensional form and do their function. And we were noticing that that process can very well have an effect whether a person's going to have a disease or not. So we thought, well, we need to understand this better, and also what genetic changes in a person would really cause an effect for a person with their protein, their enzyme that's doing that function. So we needed a more in-depth understanding to help us predict genetically, is this going to be a significant issue for a person?
Mm-hmm.
So we were looking at that, which does bring in physics to the story. And during my studies, we were noticing how important water was actually in terms of driving that. And the work that we were doing is thermodynamics, was to say, well, the relationship of the different 20 amino acids that make up a protein, these beads, what part of that is actually interacting with the water and actually setting it up twofold.
Mm-hmm.
And then we're seeing that conserved throughout evolution, so we could see what was fundamentally important.
So you're saying when the water is affected by something, it affects the foldability of the protein?
And yes, so water is seen typically in our minds as something very fluid.
Mm-hmm.
And what we were discovering was there was something else going on. We were seeing something about the structure of water that was also playing a major role. And so we were able to measure that and these effects. But these were early days. We didn't fully understand the implications of this.
Can I pause you here? Can you explain to the viewers just the concept of the structure of water? Because most people think water is H2O. There's nothing to it. The structure is there. It's already formed.
Okay, so you can say the chemical composition of water is H2O. You can also say the chemical composition of water can also be H3O2. It can also be a part of it that goes in there is OH. You've got your hydronium ions as well. You've got the free radicals that form. And then you've got the gases that are in the water too. So when we talk about H2O, we are looking at the principal chemical formula. But when you look at the dynamics and its equilibrium and its relationship with its other species, we have to take those things into consideration. And just very recently, there's been great work done by Gerald Pollack with his fifth phase of water.
Yeah.
And for us scientists, this work is important. Many of us are now noticing this has been a long-standing theory, and it's really helping us to bring this back in and say, oh, great, he's got a way of showing us how we can measure this. And he went to a tricky area where we would often say, this is voodoo science, but it's not.
Sure.
I mean, he really tackled something that most scientists wouldn't be brave enough to handle. And he mentions that in his book. And it's true. So in terms of biophysics, we were seeing these things. We have machines that enable us to see this thermodynamics. We see the driving force if water is actually structured, and what we're referring to in Pollack's work is a lattice structure that water begins to form. And that, to break that, takes energy.
Mm-hmm.
So if we need fluidity for a protein to fold, you need to break that.
Mm-hmm.
And then get it fluid again, and then you've got what you need. So nature has set itself up to balance those forces. So water becomes an intrinsic part of working out how a protein is actually going to fold. It's your environment. So it has an implication when we start looking at your salt concentrations, your pH, because your pH are the species that make up the components of water. So that's the aspect where the physics was teaching me something fundamental. And I said to myself, well, how is this going to be usable or has an implication in medical science? How can something we are intellectually grappling with. How can that be translated into the world of a person's health? And I didn't have the answer to that, but it certainly led me on to a journey I wasn't anticipating. Now, I have not had any training with HIV or medical biochemistry. I was pure biochemistry. So I wasn't trained in thinking in a particular way. However, I had a fundamental understanding. So in terms of the mechanistics, this is very helpful for doctors because they don't fully understand how they need to set up sometimes their clinical trials, or they may see a whole bunch of results that are symptomatic about a patient. And somebody like myself, a biochemist, I can actually see fundamentals. By reading the correct papers, we can actually make a story of this.
So you're not already in a box?
No, and that's systematic thinking, which later on, it's a field I became aware of. Even though I was exposed to it earlier in my career, I didn't fully comprehend that was going to be my field I'm going to enter into and integrate with my biophysics. So it's very important to have a detailed view and a broad systematic view. So it's a holistic view. And very often what's nice about biochemistry is you get the molecular understanding, and in biophysics it takes it to another level. So then it's more holistic and integrated in that way. So Baragwanath really helped me see the story of aging and the association of that with HIV, dysregulation in the metabolism, what's going on in the immune system, and patterns. And it was 3 years there that I was there, and I learned a lot. I had a tremendous insights during that period of my life working for them, which led me into my next part of my career was back into research.
Is that where the light therapy research comes in?
Not yet.
Not yet.
No. That's really only in the last year that really fell into place, how that fits in. And it fits in with water. So, no, what I needed to first do was really understand metabolism and understand the system and the body and inflammation in water and the relationship therein.
Can you just go into that a little bit for me? I'd like to understand the link between water and inflammation.
It's incredible, actually, that link. It's a surprise for me because I had an understanding of what you call redox systems biology. Okay, so we very often understand oxidative stress, and it's a typical understanding that comes from the medical sciences. However, when we deal with that, we've got to understand there's a balancing equation to that. There's a balance to oxidation, is what we call as reduction. So to get into this area would be challenging a little bit because there's a lot of details to talk about with regards to that. So how I would try and say it is there is a relationship between the way water has a very strong oxidizing component to it, a very reducing component to it, how that actually relates to voltage. And water does this naturally, and we find it in our physiology.
It has a charge to it.
Absolutely. And inflammation kind of manipulates and is a part of that story, but not in its entirety. We're only in the early stages, right, in terms of understanding structured water, because it looks like it's a fundamental part of how this physiology is actually operating on a more biophysical level. We're dealing now with voltage. And often we have been understanding the chemistry of redox, but there's a physics component to it. And this is very in-depth because we're looking at your question is asking, how can we get water to be of a more reducing potential? How do we get it to be more of an oxidizing potential? To be honest with you, we don't yet know. We're actually on the fringe of this in terms of...
But isn't water the medium that carries information?
Everything carries information.
And retains the memory.
Again, this is physics, where we're talking about information as in... We are having information in terms of how we can carry information in terms of a frequency, electromagnetic field. We can carry information through photons, which is released by water and oxidation. We can talk about information that can be relayed through molecular information. So there's always going to be information, and we say structured and programming. We really have to get into a point of, we could be talking about quantum entanglement. Then it's a non-local effect.
Right.
So we're talking about timelines now of information. So we're going down a rabbit hole.
The memory of water again. So
Yeah, it's memory is something that has a structure that can contain it, and then we can go in and measure it. And yes, that's possible, but also we can take water and give it implosive force and break it into its basic components of its gas and put it back together. And in that state of putting it back together, the imprint is going to be a lot stronger. So when we talk about trying to get something to be programmed, what I'm saying to you is, yeah, but let's get it into a quantum state. If you get it there, you get an impressive imprint of information.
Which is healing to the body.
Transformational, yes. And healing is transformation.
I just love this. I just have to say that right now. I just absolutely love this. Just the thought, just all these pictures and images that's coming to me of water and light and reflection and memory and all the imprints. I mean, it's...
Yeah. And I'm enjoying these
that's natural medicine, to me anyway.
It is. Very often we use this example. We look at water and we say, hey, look, we can actually see we are imprinting it through the various experiments that Emoto has done and so forth. And yes, scientists will question that in particular ways and the way it's been done. However, we do have instruments that can test this effect in a very quantitative way using biophysics and physics. It's out there. Now the thing is, in this area, we're going, what more can we do with this? How can we talk about it? And we can actually pull this apart into components and yet bring it back together. And very often, when we have this topic of the reflective nature of water, there's actually a way of talking about it as in structured water. It forms a structure around a bubble of air. That's a mirroring effect that we all see, so we can relate to that. So that's what many of us who are sort of engaging in this, no matter who they are, we can feel it. We can know this, and we know we can program water. So what I have come to learn in terms of the biophysics of water, the very fact that we can have a thought that can imprint, water is fundamental for the operation of this physiology being imprinted by thought. The very mechanism of the physics of consciousness requires water. It's intrinsic. So what we're actually observing on the outside there is the very fundamental mechanisms that is required for us to operate.
Can you imagine what a fetus is going through in the womb? Just being there in water. And, once there's vision, just the color pink. I can just imagine being back there.
Absolutely, yeah. So when we all talk about the water at this stage, for me, a very big part of it is let's revitalize the water. We're sensing a thing of lack, but it's reconnecting to that relationship. We understand food, but water has such a fundamental role in our health. And that vitality that everybody's talking about, I'd love to address that in a way that has such a sensible way for scientists to understand, as well as not taking away the mystery and beauty of it.
Why is it that so many people drink a lot of water but they still remain dehydrated?
So in terms of the absorption of water, we do require it to be at a pH that is to our own, which is 7.4, and often when water comes out of a tap, it's already 5.5.
And bottled water too. Bottled water is acidic.
And the aeration is very fundamentally important. So when we talk about the structured water, which we find in nature, we do need that for the absorption. And it's our bacteria in our gut that requires that too, for its efficiency. When we have structured water, we're setting up a voltage system. We need that voltage. So when we feel more enlivened, what we're actually doing is not draining our system of the voltage to try and get the water into a voltage system that we need. If we have vitalized water, we're actually taking that in and helping amplify up. So when we use light, infrared, we particularly know, is actually causing the structuring of the water. So when you talk about that, we're talking very specifically about a six-sided chain that's forming, very loose bonds, and it's almost as if it's going to create ice, but it's not. So it's in that form. We understand it's acid. So there's fundamentally clear things we understand now about this when we say structured water. That is needed. And what is going on is then we know that magnetism is going to change the amount of the oxygens bursting and going into the water, creating hydrogen peroxide, Hydrogen peroxide is very important for us too, actually. And then we've got the component of flow form.
Oh, I was going to ask you about that.
It's very, very important because we've got the least resistance. We're going with efficiency. And as you know, our heart operates in that way, creating that vortex system. So we have a technology we're focusing on that we want to bring to South Africa as a way of treating water, which is the implosion part that is required, which is what water goes through when it goes down a river. And then there's this angle of plasmafying the water, which is to increase the electron density in the plasma in there, and that's also helping with the voltage. And then the UV is, once that structure is forming, we believe that there's a type of charging up. That ring structure can charge up at something there with electrons. So what we're dealing with is the physico-chemical properties of water, which is what our bodies need. It operates that way. We have phenols in our system that we have to absorb that frequency, and water, if it's structured and charged, will carry that frequency too. So I'm coming to the world of light now with my work, because it's saying we actually need to feed our body with light and voltage. And it's not just a chemistry story, but that is complementary too. And that's kind of where a full story is starting to begin for me. And so now my work is to now focus on that area and really bring it to fruition.
Practically how?
We're focusing on a technology that is a light-based therapy for patients as well as for agriculture. We are applying treatment methods for water, finding ways to test it so we can actually say to people and say to the scientists, this is a measurable phenomena. We can actually now not just chemically know what the water situation is or the quality, but we can also know the more physics side of it that is going to be complementary to the body. And then working with the doctors, working with a team of people who understand this. And that's very important for bringing the story together.
So we obviously need to have Tessa back. And we need to break this down, and we need to make it more practical. So I can't wait to have her back with us.